Now that you've heard about the medical side of things, let me briefly explain the role of liaison teachers in helping manage diabetes in schools. There are 3 liaison teachers attached to the diabetes health team: Joy Knowles, Isabel Fernando and me, Arthur Wright. We operate from the School of Special Educational Needs, Medical and Mental Health. Remember that there are 2 other schools of special educational needs, sensory and disability. As you can see on this slide, the School of Special Educational Needs provides a valuable role in helping students, teachers and parents get the best outcome for students whose education is affected by their health, whether it's because of physical or mental health issues. Obviously, to do this, we need to have close links with both schools and the health system. The benefits for students of having strong links between hospitals and schools are clearly shown in the research undertaken by Kloss and Norris that underpins the work of the School of Special Educational Needs, Medical and Mental Health. The School of Special Educational Needs is larger than most people expect, but that's because there's a high demand for its services, simply because children and adolescents, that is, students, come into the health system as both inpatients and outpatients. It's also because it works with health in a wide range of locations. There is also an extensive network of liaison teachers in metropolitan, rural and remote parts of the state. These liaison teachers are known as CELTs, the CAMS Education Liaison Teachers, because they're attached to CAMS units which deal with students who have mental health issues. However, it is Joy, Isabel and me here in Perth who are here to help students with diabetes no matter where they live. Here you can see the connection between education at the top of the screen and health at the bottom. In the columns stretching across the screen, you can see the different types of services offered by the School of Special Educational Needs, including at the new Fiona Stanley Hospital in the right-hand column. In the white box with the blue border, you can see the home and hospital visits offered by the School of Special Educational Needs. Across the bottom is the Department of Health, with which the Department of Education connects, mainly through the Schools of Special Educational Needs. A lot of teaching takes place in hospital. For example, in the left-hand column, you can see the Perth Children's Hospital Ward teaching programs. Basically, liaison teachers are here to provide a communication link between the health team and the school in collaboration with the parents. Sometimes we gather information from a school about health, attendance, academic performance, socialisation, behaviour, concerns that a school may have about a student, to pass back to the health team. Sometimes we pass important health information from the health team to the school, and sometimes we do both. The most visible aspect of the liaison role is through the school case conference, although many issues can be resolved over the phone, by video conference or by email. The word consent is very important. Liaison teachers cannot contact a school about a specific student until written consent on one of our special forms has been obtained from the parent or guardian. Sometimes parents fill these in when they see the health team. Sometimes we ask schools to pass one on to a parent for completion. All students with a medical condition need a documented healthcare plan which is revised annually or when changes occur, such as a shift from insulin delivery via injection to via pump, or vice versa. Staff need to be aware that the student has a medical condition and what action needs to occur, both on a routine basis and in emergencies. This includes the wider staff, such as duty teachers, specialist teachers, relief teachers, and front office staff, not just the classroom teacher and education assistant, if there is one. Diabetes can influence behaviour, and some allowance may need to be made for this, but the school will have to determine how unacceptable behaviour will be dealt with. Liaison teachers can help schools determine if a student's behaviour is linked to their medical condition, and if it is not, schools should treat the behaviour in the same way they would with any of their students. All students with diabetes do require that little extra time and awareness, because they do have extra requirements. Some students are happy to check their blood glucose levels and to inject or to bolus in class. Others require privacy. However, if a student needs to go somewhere private for testing, they should always be accompanied in case they are low and don't recognise this, as they may collapse. A structured routine, which schools are very good at providing, is important to keep BGLs within the required range. Another consideration is the important social aspects of lunch and recess. Some students are given time to test and inject or bolus before these breaks so that they can enjoy more time with their friends and feel like they aren't missing out on things. Finally, it's important that a student always has access to their diabetes kit so that they can test and take appropriate corrective action when necessary. School camps obviously add another layer of complexity to diabetes management because students are away from home overnight and possibly for lengthy periods. For example, a student who doesn't do any injecting during school hours will need to inject while on camp, and this is a new level of care which needs to be taken into account. Or a student on pump who doesn't do any site changes during school hours may to do this while on camp. Parents have a responsibility to be actively involved in the planning of school camps from a diabetes perspective, and schools need to take this into account. The more notice parents have, the more effectively schools and parents can plan together. Most schools find that they have to be creative in their allocation of their support because it's needed 5 days a week, mainly at recess and lunch for testing, bolusing, and sometimes for lunchtime injections. ASWA schools and those in the Catholic system are not eligible for the Department of Education Disability Resourcing funding and should inquire through their principals about any possible funding. For those of you with upper school, that is high school students, schools can apply for extra non-working time for the WACE exams up to a maximum of 25 minutes, including testing, treatment of lows and toilet breaks over a 3-hour exam. This will not be automatically approved by the school's Curriculum and Standards Authority. The evidence is critical for a successful claim of sickness misadventure during a WACE exam. Remember that the blood glucose levels are stored in the glucometer and should be presented as evidence. If ketones are present, keep evidence of this as well. And remember, private candidates are not eligible for sickness misadventure. Let's look at some other things which may help you at school. Diabetes Basics, a set of 2 DVDs, were sent out to all schools at the end of November 2012. Parents of newly diagnosed students are given a copy at the Children's Hospital. It contains a 30-minute video on diabetes management which can help provide wider staff training and revision of basic principles. There are also useful forms which can be modified for individual student use. Diabetes nurse educators from the organisation Diabetes WA can present 1-hour seminars to schools on general diabetes information. This can be done in person or via video link. Please contact Diabetes WA for further information. This is an extremely well written and sensible book which should be shared with parents because it stresses the importance of 3 things: the shared responsibility for diabetes management, the importance of being organised, and the need for clear communication between school and home. It is given out to children who have been newly diagnosed with diabetes, but some students receive a copy when they come to their regular diabetes clinic appointments at the Children's Hospital. If you need a copy, check with the parents first to see if they have one that you can borrow. If they can't lend you one, please email us, but be aware that there are some supply issues at the moment. Because these seminars are now available online at any time, the number of face-to-face presentations at the Children's Hospital has been reduced. This website is very useful. We especially like Professor Bumblebee's guide for those younger students. You can find it on YouTube. The following 5 slides show you 2 daily schedules which can be useful to schools. The first 2 slides are screen captures of a daily schedule for a student who injects insulin. The next 3 slides are screen captures showing the daily schedule for a student who uses an insulin pump. This form, which continues on the next slide, can be reproduced and modified for individual use. Modifications, however, should be limited to adding the student's name, date of birth and photograph. The parent's phone number should also be added. If the student injects at lunchtime, this should be added. Otherwise, the form should not be modified further. We can email a copy to you. Just get in touch. You're not intended to read every word, just to get an overall impression of it, to judge whether or not it could be useful to you. In total, the form covers one A4 page and it's signed off by both school and parents. You can add student details, a photo, and laminate it so that it can go into each class roll. And here is a different daily schedule. This one is for a student who uses an insulin pump. This one covers two A4 pages, and again it is modified slightly in order to meet the individual needs of that particular student. And here's the second of those three screen captures. Again, you're not meant to read every word, just to look at the overall layout to assess whether it could be useful to you. And here's the third and last of those three screen captures for a student on insulin pump. Again, if you need one, just email us and we can send you an electronic copy. For those of you looking for more resources, school staff have access to this library, which is located in the Children's Hospital. There are books and DVDs which are aimed at children, as well as those for adults, which deal with not only diabetes, but a range of other conditions as well. Here are three images showing the School of Special Educational Needs new locations at the Perth Children's Hospital and at Fiona Stanley Hospital. Of course, these are not the only places where staff from the School of Special Educational Needs, Medical and Mental Health are located. And this is how it used to be. Thank you very much for giving up your time. If there are any questions for the Diabetes Liaison teachers, please send an email to the generic email address on this slide. Make sure you put diabetes in the subject line and it'll come to Joy, Isabel or me, Arthur.